Good afternoon, everyone. My name is Cindy Trobaugh, and I'm part of the member engagement team here at Partners. We want to thank you for joining us today for our monthly Partners Member Cafe. We have an exciting topic to go over today on the 1915 I option, and we will introduce some folks before we get started and go over some housekeeping as well. So today, joining me from member engagement, you'll see Beth Brooks, who waved everybody, Beth. She'll be helping us today with all things technical for Zoom and operating that behind the scenes. We also have Ann Bluff, who will be helping us manage the chat feature for question and answers, and also to give you all information in the chat that you can copy and paste and save that information along the way. We also have a number of folks who are serving as our panel today that I'd like to introduce. I believe everybody's on camera. And we have Allison Crotty, our Senior Director of Member Services, Tammy Gilmore, our IDD Clinical Senior Director. I'm not sure Beth is on here yet, but Beth Lackey will be joining us, our Senior Director for Provider Network. We also have Lisa Go-Harris, who is a UM Manager, Sarah Wilson, a UM Manager, and our guest speaker, who I will turn it over to in just a few minutes, Sharon Kitty, our IDD UM Team Lead. So I want to thank you all for being here as our panelists and guest speaker. Also, I want to go over just a few housekeeping tips for us so that it'll make for a better experience for everyone joined in today. We are going to be recording this session, and the recording and the PowerPoint slides will be available on our website shortly. It takes us a day or two to get those out there, and you can find those at our website at www.partnersbhm.org under the Member Education tab, and we'll put that information in the chat for you. Because we are recording, we're asking folks not to share any personal or sensitive information when you ask questions, but rather know that Partners staff is available to speak with you following the presentation, or we can schedule a one-on-one discussion with you if you would like. So you may have questions along the way, so feel free to please do one of two things. You can either at the bottom of your screen go to the Q&A feature and type in a question, and we will manage those questions at the end of the presentation. Or you can use the raise your hand feature. If you'll go to the reactions tab, click on that. You can click on raise your hand, ask your question. We'll unmute you and you can ask your question that way. And also you can click on that raise your hand button again to lower your hand following your question. So we will use some time after the presentation, as time allows, to tell you about some updates that Partners has, also to tell you a little bit more about Partners and member engagement, member services, our call lines, those types of things, and also just some highlights that we have to share with you after the presentation. So stay tuned for that after the presentation. So for right now, I'm going to go ahead. It is my pleasure to introduce to you Sharon Kitty, IDD UM Team Lead, who's going to go over an overview of the 1915 I services. Thank you all.
Good morning, everyone. I am the team lead over UM IDD services, and we'll be talking about the new 1915 I state plan amendments. And the agenda that we're going to go over is just an overview of those services. and the services that are transitioning into 1915I and how to access those 1915I services. So first, I did want to give just a brief overview of what 1915I is. 1915I is a home and community-based service that's going to be available for individuals with behavioral health, intellectual developmental disabilities, traumatic brain injuries, and it allows them the opportunity to receive services in their home or community rather than institutions. And it's going to allow extended coverage of some of the B3 services that are currently in use to additional populations. But due to federal regulations, tailored plans, we cannot offer the B3 services anymore. So we're going to be transitioning those services into 1915I. And those services are going to be available through tailored plans, North Carolina Medicaid Direct, including those enrolled in the tribal option. And upon launch, it'll be available for children and family specialty plans. The services that are transitioning from 1915I, the current B3 services will be transitioning over to 1915I. So if anyone is receiving in-home skill building, this is going to transition over into community living and support under 1915I. The B3 one-time transitional cost will transition over to 1915I community transition. The next three services, individual support, transitional living supports, and intensive recovering supports that are currently under B3, are going to all three move into an integrated one service of individual and transitional supports. And then B3 respite and B3 supported employment will also transition over into 1915I respite and supported employment. Currently, those that have B3 community navigator and community guide, once that you transition into 1915I, that component will be offered under your care management or care coordination. An overview of the services and the populations that it's going to serve. Community living and support is going to be for ages 3 and older who have diagnoses of IDD or TBI. Community transition will be available for ages 18 and above for those with intellectual developmental disabilities, severe mental illness, for substance use disorder, and for TBI. Individual and transitional support will be ages 16 and older for serious emotional disturbances, severe mental illness, and substance use disorder. Respite for IDD and TBI will be available for those ages 3 and older. And for those with serious emotional disturbances or substance use disorder, they'll be available for ages 3 to age 20. And supportive employment will be available to all target populations ages 16 and above. So the service transition, the state and Medicaid did approve 1915I to begin on July the 1st. And those that have already been determined eligible and have a prior authorization can begin services on July 1st, and we'll get more into how eligibility is determined. And those that are transitioning from a tailored plan will need to transition to 1915I by September 30th, 2023. And those that are staying under Medicaid Direct instead of going into a tailored plan will be transitioning to 1915I by June 30th, 2024. So the takeaways on this slide is that you will still be able to have your B3 services available to you while we're working on transitioning. So if you're currently receiving B3 services, you'll continue to receive those until the process that we'll go through here in just a moment on how to access and get into 1915I services. And then B3 services will continue to be available until June 30th, 2024. Right now, we are prioritizing those who are currently receiving B3 services to transition them into 1915I, starting with those that are going to be transitioning into tailored plan, since we have to have those transitioned by September 30th. And then we'll be moving into those that are not going into tailored plan to transition folks. And members who do not have a current B3 service, then we would be working on getting an assessment and evaluation and everything in place to see if they're eligible and can receive 1915I services.
Sharon, can we go back to that slide real quick? Sorry to interrupt. Just to pause on the second bullet there, says that individuals who are transitioning to Taylor Plan on October 1st. I believe we have some updates on that date for later in this presentation. So it just is individuals who are transitioning to Taylor Plan are the priority population. They must transition before Taylor Plan launches.
And so the next couple of slides will be on how to actually access the 1915I services. So this is the workflow that was developed by the state, and the following slides will address each one of these points. But the first step is to identify the need. The second step will be doing an independent assessment. Then it goes into an independent evaluation to determine 1915I eligibility. From there, once determined eligible, it goes into the care plan and ISP development. Then it goes to prior authorization and the final step of service delivery and care coordination. So the first step is identifying a need, and this is identified whenever a beneficiary visits any type of provider, whether it's primary care, physical health, behavioral health, IDD, or any other provider. That provider can identify an unmet need that could be met under 1915I services, and the provider would refer the beneficiary to their care manager or their care coordinator to help determine eligibility. So once the need is identified, it goes into the second phase of the independent assessment. And the independent assessment is completed by the care manager, and they conduct an assessment that's a very short assessment, about 4 pages, to identify the beneficiary's needed services and supports. The information gathered in this assessment will also help to determine eligibility and also help to inform when the development of the care plan and ISP takes place. This assessment is done annually. And so at first you'll have the initial assessment to get you enrolled into 1915I, and then moving forward, it will be done annually during the beneficiary's birth month. The key difference between B3 and 1915I with this assessment is that the care manager does this assessment versus a provider. Once the assessment is complete, the care manager submits that assessment to Carillon, which is the vendor who is collecting the assessments on the behalf of the state. And the state is the one who is reviewing the assessment and the information that the care manager has put into this assessment to determine if eligibility needs are met. And this is if target populations, category, medical needs, functional limitations, they're the ones who determine if eligibility is met and what services the beneficiary is eligible for under 1915I. Once eligibility is determined, it gets sent back to the care manager so that the care manager can explain what service options are available to the beneficiary. They will also help the beneficiary in identifying service providers, and they will coordinate a person-centered planning meeting to complete the care plan and the ISP. The care plan / ISP is the same thing, it's just different terminology. If you are receiving behavioral health or substance use services, it is referred to as a care plan. If you're receiving IDD or TBI services, it's referred to as an ISP. So it's the exact same thing, it's just different terminology based on the service, the population that you're in. The care manager is going to develop that care plan and ISP with the beneficiary and other identified representatives. That could include guardian, family members, provider, whoever else the beneficiary wants to be part of that plan. The key difference between this and the B3 services that some people are used to receiving is that the care manager develops the care plan or ISP versus the provider. Once the care plan and the ISP is developed, approved, and signed by the beneficiary or the guardian, the care manager submits the care plan or ISP to Partners for review. And will be conducting the review for medical necessity. And the key difference in this, again, is that the care manager is the one who submits the authorization request versus the servicing provider, which is how it's set up with B3 services. The provider submits, but under 1915I, this will be under care management. Once authorization is in place, it goes into service delivery and care coordination. The care manager is going to follow up with the providers to make sure that the services are implemented in accordance to the plan, and is going to provide ongoing care coordination, including the services process, choosing providers, monitoring the goals that are included in the care plan, keeping in close contact with the beneficiary, the service providers, and other members of the care team, making sure that the assessment and the care plan is updated annually, or if a significant change occurs, and completing that assessment as part of their annual reassessment phase. And are there any questions that we've received as far as how to access 1915I services?
So we do have a question. I'm going to give my fellow panelists a moment to get prepared to be back on camera, and we will answer those questions. So the question that we have is, what happens with families who received B3 but don't have the services because they don't have people who give the services? So I'm assuming that's staffing shortages.
Hey, I can take that one. This is Tammy Gilmore, and I am the Senior Clinical Director for IDD and TBI. The direct support workforce crisis is definitely impacting us in our area as well as across the state. If you have a service now authorized that you're not getting because the provider can't find the staff, I would encourage you to speak with your care manager. There may be other providers that deliver the service that could provide it, or there may be barriers that could be overcome. So maybe you live in a rural area and recruitment of staff is particularly difficult, and the provider may need to ask for an individualized rate, or there may be other specific barriers that we can help overcome through working with you as well as your provider. So I would discuss it with your tailored care manager. You can still transition to 1915I services. So if you have a current authorization for B3 service, your care manager should be helping you get the assessment completed for 1915I, but you'll also want to address those provider issues at the same time and try to make sure you're connected to a provider that can deliver the service, can recruit the staff to deliver the service. Thank you.
I'll just remind everyone how to ask a question. You can either enter it into the Q&A feature at the bottom of your screen, or you can go to the reactions tab at the bottom of your screen and click on raise your hand, and we will unmute you. And then you can ask your question, and then you can click on raise your hand again, and it'll lower your hand. So do we have any other questions?
We do, and I'm going to give that person an opportunity to talk. Ms. Shepherd, if you would like to unmute yourself, we'll be able to hear you.
I'm sorry, I hit that by accident. I don't have any questions.
Okay.
Thank you so much.
So I have a question that I heard just recently about this transition between B3 and 1915I. If you're not currently connected with a care coordinator or tailored care management, perhaps you opted out of tailored care management, what should the family member do to ensure they can get connected to a care manager, care coordinator?
So I will put a couple of phone numbers in the chat. We have a screening and referral team for the IDD and TBI population and a different team for mental health and substance use disorder. And if you call the number I put in the chat, they can help connect you with, or first of all, they'll confirm that you're eligible for tailored care management. And if so, they can help connect you with a tailored care manager.
Thank you, Tammy. I think the next question is very similar. How do folks who do not have a care manager find services? In the past, we would refer them to the MCO.
So I'm sorry, I have difficulty typing numbers and answering questions at the same time. So I think the question was, how do people find services?
I'll read it again. How do folks who do not have a care manager find services? In the past, we would refer them to the MCO.
Well, since this is talking about 1915I services, you have to have the assistance of a tailored care manager. So you would call the same phone numbers I'm trying to put in the chat.
Perfect.
Also, in just a few moments, we'll be sharing some information on our call lines and what numbers to call for when you have needs. So we'll share that in just a second.
The next question is, as a provider who has members receiving B3 services, who will be responsible for transitioning the members?
So as a provider, I'm sorry, can you repeat the question?
Absolutely. As a provider who has members receiving B3 services, who will be responsible for transitioning the members?
So it's really the tailored care manager in collaboration with you, the provider, because the expectation is that the tailored care manager will do the 1915I assessment, submit it to the department will do the evaluation and determine that the member is eligible for 1915I, and then you and the care manager and the family, et cetera, would work on either developing or updating the care plan or ISP to include the 1915I service. So it would really be you jointly working on it. The care manager would be responsible for submitting the plan and the prior authorization request to utilization management. You would be responsible for developing your short range goals for the 1915I service.
Thank you, Tammy. So the next question is, how will this work in a dual diagnostic person who has behavioral treatment, IDD, and mental health with their plans?
It'll work in the same way. For someone who has dual diagnosis, they may be eligible for both some of the IDD services as well as some of the MHSUD services, but they will have a single care manager, and the care manager would help do the assessment, update the plan, get the prior auth, regardless of whether it was an MHSUD service or an IDD service.
we don't have any more questions in the queue at this time.
Okay, so feel free, we have about 30 minutes left. We're going to provide some additional information about partners, give some updates, share some resources with you. But feel free, if you think of a question for the remainder of the time that relates back to this topic of the 1915 I services, feel free to put those in the chat and we will get to those questions as well as we go through. All right, I want to thank Sharon and our panelists for presenting and answering questions. It was great information today on the 1915 I, great information about services, the transition, and also about the assessment and eligibility processes. So I hope this was very helpful to you all. And now we'll go ahead and move on to our information about Partners Health Management and provide some updates. So Partners Health Management is our official name. We go by Partners, and we are a member care organization, and we are a health plan. And currently we provide services and insurance under Medicaid Direct. We manage the Medicaid Direct and also state funding for folks who need state funded services who are either not covered by Medicaid or not insured. So they have access to some services that are available through state funding. We are currently and today receiving information from the state, which is an update. So there's a hot off the press, but the state has announced the delay of the tailored plan, formerly known as North Carolina Medicaid Managed Care Behavioral Health and Intellectual and Developmental Disabilities Tailored Plan, scheduled to go live on October 1st. And the state has decided that it will be delayed. The implementation will be delayed. However, we do not have a date to give you at this time for implementation. That is still being decided at the state level. And as soon as we get additional information, we will share that with you as well. So the tailored plan is contingent on state funding. And so the budget is still being considered at the state level. So therefore, as soon as we get more information, when those decisions are made, we will share that information with you. You can stay abreast of information at any time by going to our partners website, and we encourage you to go there frequently for updates at www.partnersbhm.org. So please keep that handy and go there often for updates. We also want to encourage you to reach out to us. There are through member engagement, we'll give you information there about how to reach us through the member engagement line, and also member services, which is on the screen there at 888-235-HOPE or 4673. So these are the counties that we cover in our partners catchment area on your screen: Burke, Cabarrus, Catawba, Cleveland, Davie, Forsyth, Gaston, Iredell, Lincoln, Rutherford, Stanley, Surrey, Union, and Yadkin. We also want to highlight that on our partners website, you can get to MemberCONNECT, and we encourage you to check this out. When you go to our website, you can click on MemberCONNECT. It is our member portal. At this MemberCONNECT, you can use it for several different things. It provides messaging, much like an email, to partner staff that you could ask questions and get those answers. Also, it provides a link where you can get to many resources, the member handbook, information about rights and responsibilities. Also, you can find information about how to file a grievance or an appeal. You can also use it to access information about the find documents like your person-centered plan or your individual support plan as well. And go on to the next slide there. And this is a screenshot of what that looks like and the different things that you can click on as far as like the resources. You could take a health screening, do an assessment, self-assessment. So lots of information, lots of resources there that we share with you. And again, you can also use it as a messaging system to ask questions. So we encourage you to check that out. All right, so we also want to highlight for you some information about transitions of care or transitioning between health plans. So with North Carolina Medicaid managed care, individuals can move between health plans for the following reasons. You may have a change of your service need or benefit need. You may have a change of your county of residence or a change in your Medicaid status. So it's best if you work with your provider who can do a request to move form, which would expedite the process and get the transition of care team involved quickly. You can also go through the North Carolina Medicaid enrollment broker to do this process. And we will put this in the chat for you as well, but the enrollment broker website, you can go through that or by calling the enrollment broker's number. And also they have the TTY capability at that number that's listed on the screen. So we'll put that in the chat for you. All right, we also want to highlight our department, member engagement. We are available to help with advocacy and education and help to navigate the public behavioral health care system. And so you can reach us through a number of ways, and we will put that on the next screen for you. You can reach out to us at 704-884-2729 and speak directly with a member of our team, or you can send in an email to memberquestions@partnersbhm.org, and we'll be glad to speak with you. We also bring back information that you share with us back to partners to help inform our processes and also to improve our system. So please speak up, ask your questions, and give us some feedback through one of those means. You can also find information about partners on social media, so through Facebook or Instagram, LinkedIn, or Twitter. The Pyx Health Mobile App, you've probably heard us speaking about this each month. We've done a lot of promotion around it. It is a free mobile app that you can download to any device. It gives you access to some online assistance as well as a compassionate call center, and it will address information about depression, anxiety, loneliness. You can take self-assessments. It's really interactive. It's a great program. We encourage everybody to use it. And we're really proud to announce that we have had 750 members to register and begin using the Pyx Health Mobile App. So you can go to the www.highpyx.com. We'll also put that in the chat for you, or call the 855-499-4777 number and get assistance with registering. It's pretty easy to do, and it's a lot of fun, and it gives you a lot of resources and a lot of assistance. So we highly encourage you to check that out as well. So sometimes it's a little confusing on who to call and where do I start. So if you are working with a provider We want to encourage you to contact your provider first, as they are your first responder in a crisis. You can also call Partners Care Management if you are assigned to one. If you are not in services and have general questions, and I believe this question came up of who do I call and where do I start, you can call Member Engagement for help with resources at the 704-884-2729, or email us at memberquestions@partnersbhm.org. And you can also call our member and recipient service line here at the 888-235-HOPE or 4673. We'll go over some more information in just a minute on the call lines. Another item we'd like to highlight for you today is our CFAC, which is Consumer and Family Advisory Committee. And this is a group of volunteers that's made up of members, our family members, representing those who receive services. And a CFAC advocates on behalf of those individuals to improve the public behavioral health system. So we have meetings every month. It's very active. And we encourage you, if you would like to have a voice and be heard, we are recruiting now for CFAC membership. And so if you would like to reach out to me, Cindy Trobaugh, and there's my number on the screen, we'll put that in the chat as well, 828-323-8090, as well as you can reach out to, we have a designated mailbox, cfac@partnersbhm.org, or call our member services member engagement line at 704-884-2729. Y'all should have that memorized now. I've repeated that number about 5 times. So anyway, there's great ways to find information. Reach out to us. Here is information about our Partners Access manages several call lines. And so we want to make sure that folks have these numbers, and we'll put these in the chat as well, but go ahead and save these numbers. So our regular member and recipient service line, it's our the HOPE line that we've repeated several times at 888-235-4673 number. That line is active Monday through Saturday from 7 a.m. to 6 p.m. and it's active right now. And if you are a Medicaid member, a state funded recipient, a stakeholder, you can call that number and get directed at any time. You can also, through that member and recipient service line, it has a menu, and you can also, one of the very first things that it allows you to do is click over to our new behavioral health crisis line. So you can still reach the crisis line through that the 888 number. The next number on there is our new behavioral health crisis line, and that has been active since April 1st, and that number is 833-353-2093. We'll put that in the chat as well. That number is active and open and available to you 24 hours a day, 7 days a week, and that's open for anybody to call. So we also have a provider services line that is active right now, and that number is 877-398-4145. That number is also open Monday through Saturday from 7 a.m. to 6 p.m. The other numbers that are on the screen, the nurse services and pharmacy services, they will go live at a date to be determined in the future when we launch tailored plans, so, or just before tailored plans. So more information to come about the nurse services and pharmacy services line. Another number we encourage you to have in your phone, go ahead and put that 988 number in your phone. We encourage you to have this suicide and crisis lifeline available. We always run into someone who might just need it. So go ahead and put that right into your phone. And it is the new number. It's been available since last July 22. But it is the suicide prevention lifeline number. And that old number still works, the 8255. Many of you may already have that number saved, but you can get there simply by dialing 988. So we encourage you to save that number. So another item we'd like to encourage you to do is to keep your information up to date and stay in touch. So your current contact information is very important. So a couple of different ways you can do that is that you can, if you have Medicaid, you will go through your local Department of Social Services and update your information. Make sure that they have your current telephone number and your address so that they know how to reach you in regard to Medicaid eligibility or updates that they're doing right now from the state. Also, if you can contact us at Partners and let us know. If you have a care manager, please let your care manager know your updated phone number and address. And you can let us know at our Partners Access member and recipient service line, the 888-235-HOPE or 4673. So right now, we want to encourage you to, Beth, I'm assuming this is for the survey. Is that correct? This is the
This is the QR code for the Stay Connected, so you can subscribe to get emails.
Oh, thank you. Thank you. I knew we were going to put in a QR code and I didn't know if this was the one for the survey. Thank you. So you can click on that and stay connected. All right.
This is the one for the survey.
All right, so we have gotten fancy on you guys. We have QR codes. We are now encouraging you to give us some feedback on our member Café presentations or anything else that you've heard about today. You can hold your phone up and take a moment to scan this code and take our survey. It's a very quick survey. Also, we have a survey that will pop up when you exit Zoom. It should be on your screen to do the survey at that time. So that is the end of our presentation for today. Beth, do we have any other questions that have come in?
So panelists, get ready, turn your cameras on. I'm going to put us in gallery view again. Stop sharing. We do have one question. I am a current B3 provider. When can I expect care managers to contact us in order to transition all current B3 clients to 1915I services?
So it's going to be staggered. What they should be doing now is focusing on the 1915I assessment. They cannot work with you to develop or update the plan and submit the plan in prior auth until the Department of Health and Human Services has completed an evaluation and determined that the person is eligible. So in late June, we did receive the first list of individuals that are eligible, and that was 110 members of those that we have submitted the assessment for. We have submitted the assessment for more than 110. So there are still some in the review process at the state level, but for those individuals that were on that list that we received on June 29th, you should be getting contacted now by the tailored care manager to work with you to develop or update the plan and get that submitted to every provider probably doesn't have someone on that list. So doesn't mean that you should expect necessarily that a care manager contacts you. You might not have anyone on that list that has been approved yet. But if you're wondering, reach out to the member's tailored care manager and ask what they know about the status of that individual's transition. And they should be able to tell you whether the assessment's been submitted, whether they've heard the results of the evaluation, and what the step, where they are in the process.
Thank you, Tammy. If you have any more questions, please feel free to either use the raise your hand or pop that question in the question and answer.
Okay, I don't see any more questions coming in or any hands raised. Don't want to overlook anybody. Does anybody see any other questions? Give it just another couple of seconds to see if anything comes in. Remember, you can raise your hand or type something in the Q&A box. Well, while we're giving everybody another second to enter any last minute questions, I want to thank all the panelists for being available to answer questions. And a big thank you to Sharon Kitty for the presentation on 1915I and her team for putting that together. Thank you, Sarah, for you all doing that from our utilization management department. Big thank you to everybody. And so that ends our presentation for today. I don't see any other questions coming in. We want to thank all of our attendees for taking the time to come and listen and get information. And we hope this has been very helpful to you, and we're able to give you back, it looks like 13 minutes of your day. So again, thank you all for being here, and we'll see you next month at the next Member Cafe. Thank you, everybody. Bye-bye.